Hello learners, and welcome to chapter 10, which is the muscular system. This is where we get to explore how skeletal muscles are going to create movement through coordinated structure and function. We'll learn how these muscles are going to be attaching, how they interact, and work together to move the body with all that precision and strength. So let's see what we're going to be getting into. First, we're going to talk about origin and insertion, which is basically where muscles begin and end. Then we'll talk about muscle actions, how contraction is going to produce movement and stabilization. Next, we'll get into levers, how bones and joints are going to act as levers for force and speed of muscles. And then we'll get into fascicle arrangements. Yes, those same fascicles we talked about in chapter 9, which are bundles of muscle fibers. We get to now understand how their arrangement is going to determine power and range of motion for muscles. And then finally, we'll actually get into our muscle list, which is going to be the head, neck, and trunk, chest, shoulder girdle, and arm, pelvic girdle, hip, and leg, and of course some other structures like the patellar tendon, for example. And then finally, we'll end with intramuscular injection and muscle strains, which are going to be our clinical connections. All of this is going to help us understand how muscles work in coordinated teams. What that means is what one group does, another undoes. And they can only pull, never push. And every movement has an equal and opposite control. That's how we're going to get our brain kind of primed for this, okay? We're going to start off learning about those origin insertions, or where muscles aim to begin, to help us understand basic movements and keep on going and increasing our muscle actions as we go along to help us learn. Okay, folks? And when we get into muscle naming, that's going to definitely help us understand a lot of details about those muscles, like where they're located, their shape, their size, and sometimes even their function. Let's go ahead and get into it. Now, skeletal muscle has two ends where it attaches, okay? And those two ends get closer to one another when a muscle contracts. So those two ends are going to be called the origin and insertion. Now, the origin sometimes you'll find mostly at the proximal or medial end, and then the insertion you'll mostly find at the distal and lateral end, but of course that can change depending on the muscle. The goal of the muscle, or the job of muscle, is to make those two parts of the body get closer to one another. So that means the insertion is going to move towards the origin. Now, the origin is going to be the stationary attachment site. So that's going to be the end of the muscle that's stationary, doesn't move. And the insertion is going to be the mobile attachment site. So that's going to be the muscle end that does move. And how does it move? It gets closer to the origin. Now, we'll see this example here. We have our shoulder here, our shoulder, and then we also have our forearm, just to make it general. Then we have a muscle between those called the biceps brachii. And these biceps brachii is going to be a major muscle of the upper arm. And what do we notice about it? We notice that we have an origin for this bicep brachii here. I'll put O for origin. And then we have an insertion that kind of goes beyond that elbow joint and is going to be right there on our forearm here. Okay? And again, what do we notice here? We're noticing that the origin for this muscle is going to be at the proximal and medial end. And also the insertion is going to be at the distal or lateral end for this muscle. Okay? Now, let's talk about movements. So that's the whole portion of understanding origin and insertion. It's going to help us not only realize when the muscle is going to be beginning and end, but also determine the movement of that particular movement. Let's think about it. Our insertion is supposed to get closer to our origin. So what I want you to do is extend your arm out in an anatomical position. Okay, and what's the goal? The forearm, in order for our insertion to get closer to our origin when it comes to this muscle, our forearm has to come up. When our forearm comes up, our elbow is going to bend. And what's going to happen? That forearm is going to get closer to the shoulder, which is our origin point. So that's how our origin insertion is going to determine movement. You can also simply say we're flexing the bicep brachii. Again, the insertion of the bicep brachii is going to get closer to the origin of the bicep brachii at the actual shoulder, and that is a flexion because we are bending. Okay? Let's go ahead and look at some other actions or movements, that we normally see. We see flexion, which again I said was bending. We see extension, which is going to be to straighten. Abduction, which is going to go away from the mid or away from your abs. You can look at it that way. Adduction, which is going to go toward the mid. And rotation, which means to turn your leg out, or you can also say turn your foot out. I'm going to put turn out. And our goal is to look at these different examples of these muscles and, of course, their movement and understand the origin and insertion, and where the origin and insertion must be. Oriented here. We're trying to get oriented here. Now, what do I see? I definitely see an attachment point here, and I also see an attachment point here. So those are my two ends of that particular muscle. And this muscle is going to be a hamstring muscle called the bicep femoris. Now, I do also see attachment points on my femur, probably like a little bit on the bottom part of the ischium as well, but I definitely see the attachment point on my femur. And then I also see an attachment point here on my tibia and fibula. Okay? What is my goal? My goal is to understand where the origin and insertion is. That means which part is going to be stationary and which part is going to be moving towards that stationary portion or that origin. Okay? So, as you can see, I have it attached to my femur here. And when I bend my actual leg up, am I getting closer to the top of this muscle or further away? That's going to be the question. If I go ahead and keep on bending, I'm going all the way up here, then I am going to be getting closer to this top portion of the muscle. So that means this definitely is the origin, and this has to be the insertion. Now think about it. You can also say the origin is going to observe everything around it because it's stationary, and the insertion is going to inch closer and closer and closer to it. So as you're bending your leg, you can stand up and do this as well, and just bend your actual knee and try to have your leg get closer and closer to, again, the back of your leg there as well. And you'll see that the more closer you get, the more you're going to be contracting that particular muscle, and that will dictate where the origin is. Another thing we talked about to help you understand where the origin is the origin is usually more what? Proximal and medial, whereas the insertion is more distal and lateral. So just from that, I can just call this the origin and insertion to help you there. Now, what if we were to extend our leg back down? That means we're doing extension or straightening. Again, we can go off the origin being more proximal or medial and the insertion being distal. So that means we can verify that our origin's here, our insertion's here. Well, let's look at this actual muscle that we're focusing on. This is going to be the vastus intermedius, which is one of the quadricep muscles. Okay. As you can see, when our leg is straightened, we have a point attachment here and a point of attachment usually on our tibia. We also have a point of attachment on our femur here. And what is happening? Our origin and our insertion are further away from one another. They're not getting closer. So because of that, yes, we are saying that our origin has to be at the top, our insertion's at the bottom. Or another way you can think of this is saying that our tibia here is closer to the front of the femur. You don't see any bending. Okay, so that tibia is going to be closer to the front of the femur, whereas when you're talking about flexion, our tibia area is going to be, again, closer to the back of the femur. Whatever is going to help you remember those little details, okay? Now let's go into abduction. Abduction means away from the midline, or you can say away from the ab area, the midline, okay? Again, we can say our origin has to be proximal or medial. Our insertion has to be some type of distal or lateral. What are we doing? We're talking about this muscle here. We have an attachment here, and we have an attachment here. And we are moving our leg away from the midline, so we know we're doing abduction. What we see actually here is going to be a muscle called the gluteus medius. Okay, so we know gluteus maximus, which is a larger muscle in our bum area or rear end area. And you also have the gluteus medius, which is kind of deep to that, meaning probably underneath it. And that's the muscle that we're going to be moving here. Now, the question is, does your femur get close to the ilium? We have our ilium here, and here's our femur. Does it get close to the ilium, or does it get further away from the ilium? That's what we're looking at. So if I was to move my leg out like we see here, I notice that my muscle will be contracting, and the femur is going to be getting close to that ilium. Okay? So that means that our femur is definitely going to be, our femur area, or attachment is going to be our insertion, and our ilium is going to be our origin. It doesn't move. Now let's get into our movement of adduction. Adduction means you're moving your leg toward the middle of the body for this example. And we have our muscle here. This is going to be our adductor longus. So that means, yes, it's going to be a muscle that helps with adduction, and it's very long. That's where the longest part comes in. Again, you can go off with a little trick of saying origin is always proximal medial. The insertion is usually always distal lateral. It's not perfect, but that'll help you kind of get your brain primed. And what you'll notice is we have an insertion here near that pubic symphysis, or you can just say your pubis, and then we also have another insertion on the femur. Now, when we are taking our leg and moving it toward the midline for adduction, another way we can say this is the inside of the femur closer to the pubis or further away from the pubis? Think about the motion itself. Do the motion on yourself. Stand up and do this motion now, right? To make yourself how to understand, is this going to be toward the mid or further away? And since we already gave you that muscle and gave you like this overall diagram, you're basically saying, is this femur going to be closer to the pubis or further away from the pubis? That's going to be the question. And as you can see, the inside of the femur here, where that attachment is going to be closer to the pubis. And so because the femur is going to be the one that has to be closer or further away, we know that's the mobile one, and that has to do with insertion. Therefore, the pubis is going to be the origin. Another example of how to do that. Now, finally, let's go ahead and talk about rotation. So here it looks like we have like the sacrum here. We also have that greater trochanter of the femur. So I'll see some sacrum up here. And then I also see femur down here. To make it easier. We also see rotation. So we're going to be turning that leg out or turning that foot out. And the muscle that we're focused on here, little muscle called the piriformis. Okay, and so the question is going to be, is my femur getting closer to the sacrum or is it going to be further away from the sacrum? And if the femur is going to be the thing that's going to be getting closer and further away, automatically I know that my femur has to be the insertion. That's the thing that's going to be causing that movement. So therefore, my sacrum is going to be the origin. You stand up and do this. Basically, turn your foot out, and you ask yourself, is my femur getting closer to the sacrum or further away? When you turn your foot out, you see it's getting closer, and that will help you understand that, hey, that muscle attachment as well, the muscle that's going to be attached to that femur is getting closer to that sacrum as well, and there is your movement. So essentially, if you know the origin and insertion, then you'll be able to understand the movement. Flexion, extension, abduction, adduction, rotation. And of course, if you know the movement, then you'll be able to determine the origin and insertion. So this is going to be very important for you to know. And I recommend, again, even if you don't have all the details right now of all the different muscle names, understand like just a general muscle, like we said here with the biceps brachii. Just understand and tell yourself, okay, I have my biceps brachii. What's going to be the insertion? The thing that gets closer to the origin. First, distinguish what your origin and insertion is. And then, of course, move your insertion closer to your origin and start making sense of it that way. Let's get into an example. What I know for sure is examples are going to be ramping up for a lot of the different chapters that we get into because it's just going to be more important. So for example, it says the origins and insertions of different muscles are given. So they already gave you that. What type of movement or movements would be created when these muscles contract? So they're saying, here's some origins and insertions. What are going to be the movements or movements? Okay? First, let's go ahead and get ourselves oriented. So here we're looking at our rectus abdominis. That's going to be our abdominal muscles, and they're usually straight. That's where that rectus name comes from. So we have our rectus abdominis here, so we can write that here. We also have our sternocleidomastoid. And this name seems very long, but really it just means that your origin is going to be the sternum and, of course, the clavicle area, that's the cleido portion. And the insertion area is going to be your mastoid, or your mastoid process, okay, which we know is a portion of that temporal bone. And going back to the skull bone. And then finally, we have our same one that we saw before, our adductor longus. Now, what is this name telling us? Adductor, that's going to be the actual action or movement of that muscle, and longus means that it's long. Abdominis is going to tell us the region of where this muscle is, and rectus means straight fibers. So those are little details. Of course, we'll start learning more of this when we get into muscle naming. So rectus abdominis, we know we're going to be dealing with the abs themselves because that's in the name itself. Now let's talk about our origin and our insertion. It says our origin is going to be the pubis here, so here's our origin. And it also says the insertion is going to be the xiphoid process. So remember, the xiphoid process is just a piece of the name on the lower portion of the sternum itself. So we'll see the insertion right here where the xiphoid process is. Now it says what type of movement or movements will be created when these muscles contract. So what is our goal? Our goal is to have this insertion get closer to our origin. Let me get a better color. We want our insertion to get closer to our origin. So you can either stand up or I'm sitting down, right? So I can sit down, and my goal is to have that xiphoid process get closer to my pubis area. So I'm going to be doing what? Flexing my trunk forward. What does that actually mean? Well, if I'm moving my trunk forward, right, or flexion of the forward, the trunk forward if you want, or flexion of the trunk, whatever you want to say, then I'm also going to be moving my vertebrae or my spine as well. And I'm also going to be bending at the hips. So a lot of times you'll see folks just say, okay, that means that you are going to be moving, you're going to move forward some kind of way to, again, contract these muscles. The muscle rectus abdominis. You're going to be flexion of the spine, or you're going to flex the spine. That's one thing that people say. Just to make it simple, it's like when you flex the spine, that's automatically going to tell you that you are going to be moving forward. Okay, so that's one way we can say that as well. Could you add in that you're going to be bending at the hips? Sure. Could you add in that you are moving the trunk forward and you have trunk flexion? Sure. All those would actually include it. But we want to make it as simple as possible, because trunk flexion means that you're also flexing the spine. So you can just say flexion of the spine, flex the spine, move forward, whatever you want. Okay? And excuse me. And when you're in exams, for example, sometimes it depends on the professor, but sometimes they're like, you need to have, and say particularly flexion of the spine instead of flex the spine. To me, if you put flex the spine or flex spine, I will accept it, because I know that flex and flexion can kind of be interchangeable a little bit. All right. Let's talk about our next muscle, the sternocleidomastoid. So the origin is going to be the manubrium. So we have our origin here. Remember, the manubrium is going to be the upper portion of our sternum. And therefore, our insertion is going to be our mastoid process, which you can also say is that bump behind your ear, part of the temporal bone of the skull. Okay? Now, what are we trying to do? We're trying to get our insertion to be closer to our origin. How can we do this? And remember, practice on yourself as well. How can I make that mastoid process get closer to my sternum and my clavicle? Think about it. Can I just flex my head forward? Or, excuse me, flex my neck forward? Yes. I can flex my neck forward, so you can have flexion of the neck. That's the first movement that comes to mind. Can I rotate my head and flex my neck? So can I rotate my head and have it to where, say, for example, let's all turn to the right. You turn to the right and then bring your chin down. Am I now going to be near my clavicle area and, of course, my sternum area? Yeah, you could be in that area that way as well. So you also can rotate your head. Rotating your head can move that down, and now you can realize how many different types of movements that you can have with the sternocleidomastoid when you're talking about the origin and insertion of it, which is pretty cool. So that sternocleidomastoid, you can even feel if you turn your neck to the left or right. You see that big muscle that's kind of puffing out? That's your sternocleidomastoid. And you can understand the location because, remember, we know the origin and insertion. So it's the mastoid process, and it goes down to the sternum, upper sternum, the manubrium, and of course, it does have an origin point on the clavicle as well. That can help you with that process too. Let's go ahead and talk about our adductor longus. So the adductor longus, as you can see, has an origin at the pubis, so that's going to make it a little bit easier, and we'll just focus on this one over here. But it also has an insertion at the linea aspera of the femur. Really fancy way of saying what bone marking? A line. That's the bone marking. So on the back of the actual femur here, you'll see this line, and that line there is going to be our insertion. So it's going to be a line on the back of the femur. Boom. Okay? And so you can actually just say that's our insertion point there. I just want to show you because sometimes the wording can get very fancy, right? Just as the name suggests from the muscle, adductor longus, what type of movement are we looking at when it comes to the adductor longus here, based on the insertion of the origin? Well, that means it's going to adduct. So it's going to be adducting, and what's going to happen? It's going to go toward the mid. So if you go ahead and try to insert or move towards the midline, then what's going to happen? That insertion is going to get closer to that origin. So because it's in the name, you can just say adducts. Adducts what? The thigh. So if you're standing up, your goal is to just try to move your thighs inward, 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 and now you're adducting the thigh using the adductor longus. There you go. I will say, yes, these videos will be kind of long, but we do have 2 days to go over it. I want you to spend time actually trying to learn this. Use your body as an example and take your time. The next video we're going to get into is muscle actions, which means that we now have to contribute movement to our understanding of the ability of muscles to take on different roles to perform that movement. We're getting a little bit later here, okay, folks? I'll see you in the next video.